Clinical assessment is something that is needed in all patients with CLL, and still we need to follow the current international guidelines, which have shown a really agreement in all the basic assessment that we should perform in all patients with CLL at the time of the diagnosis or either before therapy. I think it's very important to have a very good medical history, including comorbidities, and of course to have a lab exam and also physical examination. In terms of clinical stages, they give us, they are very useful because they are very simple, and we still need to follow, to do the clinical staging in patients with CLL, because that gives us the prognosis of all individual patients. And I think that's all. So there was a little bit of controversy regarding the role of CT scan in these patients. So still, the general recommendation is to perform CT scans within clinical trials, because we have learned that in some studies that there is, although they may have somehow, they may be associated with a higher risk of progression, so still, I mean, there are, in terms of the PET-CT, so there are many false positive results, and imaging studies then are not required in daily practice unless they are clinically indicated. So this is a key point in the management of patients with CLL, that CT scan should not be performed outside clinical trials.